If you're in your 40s or maybe even your late 30s and you're hearing stuff about perimenopause, you're wondering, well, shoot, maybe I'm in perimenopause. Maybe that's why I'm having the symptoms I'm having. Today, I'm talking about 9 signs of perimenopause and the hormonal changes that are happening to cause them. So, if that's you, if you're falling into that category, you don't want to miss this.
Welcome to She's Healthy, a podcast for ambitious women on their journey to become the healthiest version of themselves. I'm your host, Lori Aikman.
Welcome back to the She's Healthy podcast. I am Lori Aikman, your host. I am a nurse practitioner and I'm the founder and CEO of Crown Executive Health, where we help busy professional women regain and sustain their energy through comprehensive hormone management so that they can feel like themselves again. I hear from so many women that they feel like they're living in somebody else's body. They don't recognize their body anymore. And we use functional medicine approach in our care with our clients. So this podcast, She's Healthy, we talk about that. We talk about these women's health topics from a functional medicine perspective. So if this is the first time you're listening to us, stay tuned. That's what's ahead. Also, I want you to know I try to make these episodes because a lot of our listeners are busy working professional women, moms, things of that nature. I know you don't have a lot of time. I don't have a lot of time either. So we try to make these episodes 20, 30 minutes in length so you can listen to it on your car ride, things like that, make it easily digestible for you. All right. So I do have to give you my medical disclaimer before I dive in. So I am a nurse practitioner, but this podcast is for informational purposes only. This is not, prescribed medical advice. Please consult your doctor, your practitioner, your provider before you make any changes to your healthcare plan. Okay. Now that I give you that, let's dive in. So today we're talking 9 signs of perimenopause. So first I have to give you the little bit of background. Okay, perimenopause. What the heck does that mean? So menopause, as you've probably heard, right, is when, and maybe you don't even know what happened. Menopause means hot flashes and you're getting older, but what does it actually mean? So in menopause happens when you haven't had periods. Like if you go to your OBGYN, your doctor, if you haven't had a period for 12 months and you're around age 50, they're going to say, okay, you're probably in menopause. And there's some labs they can test, some hormones they can test. But what happens is that your ovaries have stopped cycling. So we have our, monthly period or every 28-day period. What that is your menstrual cycle, where your body is releasing an egg, your ovary is releasing a follicle and an egg, and that releases estrogen, progesterone. You go through the cycle, you have a period, etc. So in menopause, that stops. Your ovaries aren't producing eggs anymore, and you stop having a period. You stop cycling. But leading up to that is a time of what we call perimenopause. And this can actually happen. Mostly this happens in your 40s, but this can happen up to 10 years before you hit menopause. And I'll tell you, there's an age range. Like most women are going to go through menopause somewhere between 45, 55 years old. The average age of menopause is 51. And then you can start having hormonal changes about 10 years before that. So, if you're somebody who's going to go through menopause earlier, this could be in your mid, to late 30s. You can start seeing these changes. If you, are somebody who it might not be until your 40s where you have these changes. But there's 2 things that are going to happen during perimenopause, one is that your progesterone is going to stop decreasing. Okay. So you might've heard of the 2 sex hormones for women. Testosterone, a lot of us think of as a male hormone, although we have testosterone too. Estrogen and progesterone, and men have estrogen and progesterone, but estrogen and progesterone are more dominant in us because they come from that egg, that follicle that gets released in our cycle. So in perimenopause, your progesterone starts decreasing. So the amount of progesterone produced by your egg, by that it's actually the follicle, which becomes the corpus luteum. You might not care, but if you've heard of the luteal phase, that's where that term comes from, is the corpus luteum produces progesterone. So if you don't care about any of that, what's important to know is that the level of progesterone starts decreasing. Well, what you have to know is that estrogen and progesterone should be in balance. So progesterone helps to balance out estrogen. So when we're in perimenopause, that progesterone is going to go lower and it's not going to be there to balance out that estrogen. So one of the hormonal changes that's happening is that you're having low progesterone levels. Okay. Then later in menopause, like the closer you get to menopause, your estrogen kind of stays steady. And then the closer you get to menopause, you can actually have fluctuations in your estrogen. I think there's some schools of thought that like the estrogen just goes down with the progesterone. But what they actually see is that you can have swings in estrogen, where estrogen might be higher at times and estrogen might drop. And those swings in estrogen are going to cause a lot of those menopausal symptoms that women have, like hot flashes and things like that. So that's a little background of like, okay, what's actually going on with your hormones? Okay, so how does that actually show up in your body? What are you going to experience when you're having these changes? So one of the thing is like heavier and longer periods. Now, you might be somebody who's had low progesterone. You can have low progesterone when you're younger. I see patients in their 20s and 30s who have low progesterone. So it's not just a perimenopause menopause thing. But if you're somebody who like you notice a change, like you're okay, I hit 40, whatever, and my periods are getting a lot heavier. My periods are getting a lot longer. What can be happening is that again, you're having that lower progesterone, because what's going on is that you have, so let me back up. I feel like I can't just explain the signs. I have to explain why that's happening. So when you have your menstrual cycle, your estrogen causes, where your period comes from is that your uterine lining is actually shedding. So that's where the blood and a little bit of tissue comes from. TMI, if that grosses you out. But so when you have low progesterone helps to keep, and let me say, estrogen is the hormone that causes the uterine lining to thicken. Okay. So, and we have to think about this from like a procreation standpoint. Like that's what's really, the process happening is your uterus, so your that follicle starts getting ready. Your body starts getting the egg ready that's going to be released. It is producing estrogen. Estrogen is causing the uterine lining, the lining of your uterus, to thicken up, because then you're going to ovulate. That egg is going to release. And if that egg and sperm combine, then the goal is, right, that the uterus is ready for the egg and sperm to implant. And then obviously you'd be pregnant, right? So, but when that doesn't happen, you don't get pregnant, okay, then you have a period, and then that uterine lining, sheds, you have your period, you have your bleed. So what progesterone does is keeps that uterine lining from getting too thick. So when we have a lot of estrogen or too little progesterone or a combination of both, what happens is that uterine lining can get really thick. And then so when you do have your period, there's a lot more bleeding. Bleeding lasts longer than maybe what's normal for you. I'll have to on another episode talk about what actually is normal. What is actually a normal bleed? So how would you know but if this episode purposes, if you have a change where, okay, my bleeding was usually like this and now it's like this, I'm having to, do things differently. You guys know, I won't get into too many details. That could be a sign that your progesterone is decreasing. Okay. The other sign is that you can be having short cycles. You can be like, I've always been like a 28, 30-day, cycle. And now my cycles are like 24 days, 21 days, things like that. Again, what is happening is that low progesterone. Okay. So back to what's happening in the body. So we have, the follicle gets ready, the egg is getting ready to release, the uterus is thickening. You have ovulation, so the egg gets released. And if there isn't a lot of progesterone, there's inadequate progesterone coming from that follicle, that corpus luteum, you can also have what's called a short luteal phase. So again, I'm having to like diving way deeper in than I planned to. But so your 4 phases of your cycle are your menstrual phase, which is like your period, your bleed. You have the follicular phase is when that egg is getting ready. Ovulation, the egg is released. And then the luteal phase would be the time where if pregnancy is going to happen, it's going to happen there. That egg has been released. It's hanging out. Is it going to combine with, sperm and implant? Is it not? And then if it doesn't, you have your period. So that luteal, so the progesterone again is coming from the corpus luteum in that luteal phase. But if we have sometimes we can have periods where we're not ovulating, where we don't release an egg, or we do ovulate and it's a very low amount of progesterone. And what happens is that phase, that time between ovulation and then when you start your next period gets shorter. And so then your whole period, right? You're like, oh, my period came a week early. That again is a sign that it's a low progesterone. Perimenopause, progesterone is decreasing. Maybe you're not even ovulating on some of your cycles. So that is another sign. Sign number 2. These are not quick and easy points that I thought I was going to give you. All right. Sign number 3, you can have increased breast pain. So again, this is okay. Why? What's going on is again, the low progesterone, kind of more estrogen during this time. And what that can translate is you can have more breast pain, more tenderness, and even more lumpy breast. So when we have, again, that imbalance of estrogen and progesterone, so estrogen is high and progesterone is low, okay? Either estrogen is high or normal and progesterone is low. Doesn't matter. We've got more estrogen. That's where that term estrogen dominance comes from. So we've got estrogen dominance going on. What happens is that we can actually get more fibrocystic changes in our breasts. So our breasts get more lumpy, bumpy, tender, swollen, things of that nature. And again, what is happening is that, okay, we don't have enough progesterone on board to help balance out that estrogen. Sign number 4, excuse me, so that was 3, is waking up in the middle of the night. So this one can really stink. I know a lot of women that when they hit perimenopause, menopause, they start really struggling with insomnia. Why that is progesterone. Again, it all comes back to what's going on with estrogen and progesterone. So progesterone is what we call a precursor to GABA. So progesterone helps to make this neurotransmitter, this brain chemical we have called GABA. Well, GABA is a calming neurotransmitter. So GABA helps us to sleep. You can even buy supplements you can go to the health food store and buy L-theanine GABA support, that's going to help to stimulate GABA. So we have low progesterone. Low progesterone helps to make that GABA. So then we're getting lower GABA levels. And how that translates is we don't sleep through the night. We start waking up more. I will tell you, it's not on my list, but should be, is what also can happen is that you can have more anxiety during that time. So here we go, 10 signs. We're adding another sign. You can actually have more anxiety during perimenopause. And again, that is a hormonal change, right? So I talk about this a lot because, and I see other OBGYNs, just people who are more in this space talking about that, because so many women go to the doctor and they're like, I'm having new anxiety, I'm having new depression, and they're getting put on antidepressants. Well, it's not the problem. The problem is they don't have enough progesterone, and maybe balancing their hormones would actually make their anxiety go away, help them sleep, rather than, because I have talked to many women who are like, I'm going to the doctor, they're putting me on the antidepressants, they're not helping, I don't feel depressed, because that's not really the problem, right? The problem is that they just need more hormone. They need more progesterone. We need to boost their progesterone until they finally have hit menopause or whatever. And we can then change things from there. So that extra bonus number 5 is new or increased anxiety that you haven't experienced before. Okay. So 1, 2, 3, 4, 5. All right. I think what I'm going to do, so we're 15 minutes in. Okay. I'm gonna give you one more point, and then I'm actually gonna break this into a separate episode, because I was gonna separate signs and then hormonal changes, but it's kind of hard to talk about the signs without the hormonal changes. So if you guys are watching this, here we go. We're changing things on the fly. All right, so number 6 is you can have increased, we talked about the heavy bleeding, but you can have worse cramps during perimenopause. So again, you can probably guess now, everything comes back to that estrogen and progesterone. We have progesterone, where progesterone is going to, help to balance out estrogen. But if we start losing that progesterone, we have that higher estrogen, that excess estrogen. What can happen is that we can have a lot, like not only that heavier periods, but more discomfort with our periods. And again, that's an estrogen excess thing. And I'll just get back on my soapbox again about what you'll see a lot of times, if this is you might go to the doctor, you might go to your OBGYN and go, my cycle's changing, my PMS is worse. And they go, well, let's put you on birth control. That'll balance things out. Well, technically, it's not actually balancing things out. And if we took a look, we could see, okay, we've got lower progesterone levels. That's probably what's causing these symptoms that they're having. And there is some evidence for treating. It just depends on what exactly is going on with your hormones, but you can supplement progesterone. You can treat progesterone. We can actually get progesterone over the counter topically, or you can get progesterone. You can get prescription strength progesterone. Is microionized progesterone. The dosage would be about 100 to 200 milligram capsule that you'd take by mouth, versus the topical progesterone cream that you can get, over the counter, is only about 40 milligrams topically. But again, if this is you and you're like, yeah, I went to the doctor and they told me all I can do is go on birth control, and I don't want to go on birth control. Maybe you have, I've talked to women all the time who have had adverse effects with birth control. So you don't want to go down that route, but you feel stuck. Well, there is something you can actually do about it, right? We can help support those progesterone levels in different ways to help balance out these symptoms. So, all right. So I'm actually going to leave it there. We'll pick up with, we've got 1, 2, 3, 4 more perimenopause signs that we'll talk about in the next episode. But I just want to say, if this is you're listening to this episode and you're going, oh my gosh, you're explaining all my symptoms. This makes so much sense. I think I think I'm in perimenopause. Like, what can I do about it? What I invite you to do is book a connection call with our Crown Executive Health team. The call will either be with myself or someone from our team, just to hear about you, hear what symptoms you're having, and we can help you, know what your next best step is. We have a ton of free resources, podcast episodes, handouts, things like that, that we'd be happy to provide you. Or if you're ready to get help, you want to get testing, you want to start really taking action on this, we can tell you what those options look like. So I'll put the link in the comments below or in the show notes below. I invite you to book a connection call. You don't have to stay stuck, right? You don't have to settle for birth control is the only option and there's nothing we can do. And that's just not true. We just need a different approach. Okay. So if you also heard this episode and you thought of somebody else who needs to hear this message, right? Who might be in your same age range, maybe it's a friend in her 40s, please forward this podcast or, podcast episode, YouTube episode onto her so that she can get the help she needs. All right. I will see you next time.